Captain Neethu from OSCE Success Hub, Adelaide. In the various social media platform, I have seen many people are sharing their disappointments and as a post or comments related to the rejection emails which they receive after applying for registered nurse job in Australia. If you are one among them, this video is for you. I'm going to share how to prepare an impressive CV, and I will tell you the tips and tricks that you can utilize to make an impressive CV. Though Australia has a lot of job opportunities for the nurses, the competition exists, especially in securing jobs in cities like Sydney, Melbourne, and Brisbane. So, a well organized, prepared, professional, ATS-friendly CV will help you to get invited for the interviews. Please understand that an impressive CV is a important factor and which represents you and tempt the employer to invite you for the interview. If you are able to secure a job in Australia, it will give you professional development, career growth, and also helps to secure a permanent residency in Australia. So let's watch the video. So you might have noticed I'm mentioning about ATS. What is ATS? Application Tracking System. It's a software which is used by the hospitals, aged care, and the Australian healthcare recruiters to screen the applications which they are receiving for the job advertisements. If your CV is not formatted according to the ATS requirements, your CV is not going to reach up to the recruiters like HR managers or managers, and your CV will get automatically rejected though you have the required education and the skills. So in nutshell, the tips for ATS-friendly CV is that please use simple and professional layout and language. In layout, try to avoid more columns and images, pictures, designs, and graphs. Use simple headings like professional experience or work experience rather than writing my career journey. And while saving your CV, just name it under your name and use the formats like document or PDF rather than JNG or PNEG format. And also don't include special abbreviations or special characters like inverted commas. Example, rather than writing ICU, you write intensive care unit, and try to avoid special characters like colons, semicolons, inverted commas, because all these special abbreviations are not read by the ATS. Let's see what are the common ATS software used by healthcare recruiters in Australia. The first one is Workday Recruiting, used by public hospitals and private healthcare providers. PageUp, which is used by Australian health networks. SAP, Success Factors, used by aged care and nursing agencies. iSIMS Talent Cloud, used by major hospitals and recruiters. Bullhorn, used by nursing recruitment agencies. Lever and Greenhouse, used by healthcare startups and private clinics. If you have prepared an CV and you want to try whether it is ATS friendly, you can copy and paste your CV text into a plain text editor notepad in Windows, or text edit in Mac users, or online alternatives like Google Documents, Notepad Plus, Sublime Text, etc. If it displays correctly without strange formatting issues, it is ATS friendly. Next, I will introduce the best site for nursing CV preparation in Australia. Free CV builders and templates are Canva. You can find the link in this slide, and the next one is Zeti and Novo Resume. These are the free ones, and Australian specific nursing CV help you can get from Nursing Careers Australia, Seek Resume Builder, and Indeed CV Builder. Let's see the structure of the CV. In the structure of the CV, the first one is personal information. It should include your name, APRA registration number, your contact details, address, phone number, email ID, and the LinkedIn profile if you have any. Don't include your gender or your religion, all those information. That is not at all relevant. And after that comes the professional summary. Try to concise your professional experience and your education and prepare a proper summary which include 3 to 4 sentences, not more than 5 sentences. After that, you can include your work experience, start from the recent experience, and there is a particular format that I will explain you that, and then include your educational history, and the reason one comes the first. After that, any certifications or the any particular programs which you have undergone, that you can include. The next comes your special skills. Include the nursing related skill. Try to avoid the skills which is not relevant to nursing. Then the references. It is important to include the references. If you are not including your reference, some of the ATS softwares will search for references in your CV. So if you are not including the references, there is a chance for your CV to get rejected. So this is a normal format, and I will discuss each heading one by one. In the career objective or professional summary, highlight your key skills, years of experience, and specialization. This is an example. Compassionate and dedicated registered nurse with 5+ years of experience in acute care and emergency nursing. APRA registered with strong skills in patient care, medication administration, and clinical decision making. Passionate about delivering high quality patient centered healthcare. The other one, caring and highly experienced pediatric nurse with 6 years of expertise in providing specialized care to infants, children, and adolescents in pediatric ward settings, skilled in pediatric assessments, medication administration, growth and development monitoring, neonatal and pediatric resuscitation, and family-centered care, adept at managing acute and chronic pediatric conditions while creating a supportive and comforting environment for both patients and families, passionate about child advocacy, health promotion, and continuous education in previous nursing. Another one, dedicated and detail-oriented surgical ward nurse with 4 years of experience delivering pre-operative and post-operative care to patients undergoing various surgical procedures, skilled in pain management, wound care, infection control, drain and catheter management, and patient mobilization, experienced in working with multidisciplinary surgical team to ensure optimal patient recovery, committed to providing safe, compassionate, and high-quality nursing care with a strong focus on patient education and rehabilitation. Next is about writing professional experience. As I told, try to include most recent experience first and try to follow this format. First, write the job title, then hospital or the clinic name, the date of employment, and the responsibilities and the achievements in bullet points. One example for it is registered nurse, ICU, Royal Melbourne Hospital, Jan 2020 to present, provided critical care to patients with complex medical conditions, administered medications, IV therapies, and monitored patient responses, led a team of junior nurses, and assisted in training programs. See, this is a perfect format. Next we will see how to write educational qualifications. Follow this format: course, name of the college, university name, year, and achievements. The next is certifications and additional training like advanced life support, basic life support, mental health first aid, infection control, and prevention. You can include your professional membership details also, like Australian Nursing and Midwifery Federation, Australian College of Nursing membership, etc. The next is references. When you include references, please take permission from the people whose names you are going to list out. Otherwise, when they are contacting, there are chances these referees are not responding to the recruiters, and you may lose your chance of selection. So take prior permission and include their name in your references, and try to include this heading reference, because some of the ATS softwares screen for this references. So if you are not including references in your CV, there is chance for rejection. Now I tell you some alternative words you can use in your CV rather than going for the normal usual ones. So if you are from a critical care and emergency response department, rather than writing responded to, you can write intervened in reacted to and handled. And for stabilized, you can write resuscitated, revived, and controlled. Monitored can be replaced with tracked, analyzed, supervised. Operated, that can be replaced with managed, adjusted, and utilized. And if you are from surgical or peri-operative nursing background, instead of using prepared, you can write organized, arranged, re-aided, assisted in. For before the, instead of that, you can use aided, supported, collaborated in. Rather than using handled, you can write managed, utilized, executed. And instead of writing coordinated, you can write orchestrated, led, or directed. And in the documentation and communication, you can write documentation been rather than writing recording, you can write documented, logged, or noted. Rather than saying reported, you can tell communicated, conveyed, or presented. Rather than writing educated, you can write instructed, counseled, or advised. Rather than writing explained, you can write clarified, guided, or informed. And in the skills like leadership and teamwork, you can use the word directed, supervised, and managed for led, and partnered, engaged, coordinated instead of collaborated, mentored, coached, or instructed for trained, enhanced, optimized, strengthened for improved. This is a job advertisement in Seek, and the employer is telling about the opportunity. So, if you read carefully, you can see what are the expectations of this particular role, or we can say as a selection criteria. Like these are the qualities they are looking in this particular role, like provide nursing services in health service setting, ensuring quality for care clients, patients, and families, collaborate with other healthcare professionals, provide education and information to client and families. So when you write your CV for this particular job application, try to include these keywords in your work experience and professional summary. This shows that for every job application, you may need to edit or prepare a new CV for applying that particular job. I'm just sharing my CV with all of you so that you can get an overview regarding the layout. I hope today's video related to the tips and tricks for preparing a proper CV for registered nurse jobs in Australia was useful to you. If you believe this was useful, please follow us on our social media pages. This is me, Neethu, signing off from OSCE Success Hub, Adelaide. See you later.